At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Hey everybody, good afternoon. I'm Dr. Pauline and welcome to this week's MedsPLUS Medical Minute. So, happy April, and I hope you all had an amazing Easter celebration this past weekend. This is our first MedsPLUS Medical Minute live in April. And I want to wish you a happy Minority Health Month. Happy Minority Health Month. So April of every year is designated as a time to observe Minority Health Month. But something feels a little bit different this year. As I went through my normal day researching, trying to figure out what I'm going to talk about, what I want to let y'all know about, it felt different. I went to my normal websites where I do my research, and there was actually not a theme for 2026. Now, for decades, April has been designated as Minority Health Awareness Month to bring awareness to health disparities in underserved communities. The U.S. formally recognized Minority Health Month back in 2002, and the effort goes back even further to 1987. But this year, there has been a noticeable lack of visibility, less urgency, less conversation at the national level. And for communities that we serve, that matters, because the issues that Minority Health Month represents have not gone away. We are still seeing higher rates of diabetes, high blood pressure, heart disease, and kidney disease in our communities. We are still seeing barriers to access, barriers to education, and barriers to care. So if the spotlight is dimmer this year, that does not mean the problem is smaller. It just means the responsibility shifts to us, to community providers, to organizations like MedsPLUS, and to individuals. That means you, because health equity is not a trend, it's a commitment. So let's talk about where to start. The first thing I want to let y'all know, and Dr. Jennifer and I say this week after week, know your numbers. Individually, know your numbers. Know your blood pressure, know your blood sugar, know your A1C, know your cholesterol, and also know your kidney function, because these numbers tell the story of your health, often before you feel anything wrong. High blood pressure is called the silent killer for a reason. Diabetes can be progressing even when you feel fine. And kidney disease often doesn't show a single symptom until it's advanced. That's why knowing your numbers is not optional, it's essential. And once you know your numbers, you can take action, you can make changes, and more importantly, you can ask better questions. Partner with your healthcare team, because that's where the difference matters. So last week, I was at a community event here locally in Birmingham, and I met a woman living with diabetes and high blood pressure. She told me that she had been previously prescribed the medication Mounjaro and that she was doing really well. Her numbers were improving, she felt better. But one day she went to the pharmacy to pick up her prescription and she couldn't get it. So she asked the pharmacist, what was going on. They told her that she couldn't get her medication. She went back to her doctor's office and the doctor didn't know why. And the reality is many times providers don't actually know what happens to that prescription after it leaves their office. So it could be a coverage issue. Maybe her insurance no longer covered the medication. It could be a copay issue. Maybe the medication went to a higher tier on her insurance, therefore her copay is higher. It could be a stock issue. We know at one point GLPs were on the shortage list and they weren't able to get it. So there could be a number of reasons why this patient did not know what was going on with her medication. But the main thing is she did not know. And she wasn't able to articulate to me what was going on. And that gap, that's the gap that MedsPLUS is here to bridge. That gap costs people their progress. And when I asked her about, if anyone had explained to her why she wasn't able to get her medication, she said no one explained. So I told her, you need to come to a pharmacy like MedsPLUS, because we would not allow you to not get your medication without a reason, and more importantly, without a solution. Her response to me was, well, MedsPLUS is all the way in downtown Birmingham, and I live in the part of town she lived in. But her doctors were at UAB, the hospital is at UAB, and you all know that we are minutes away from UAB. But the more important part of this story is sometimes convenience, that neighborhood drugstore that you can sit in the drive-through line and wait on your prescription, sometimes that convenience is not always what's best for your health. You need a pharmacy that works with you and with your providers to make sure you're reaching your health goals. And that's the MedsPLUS difference. We don't just fill prescriptions. We help you understand what's happening. We work to remove those barriers, and we help you stay on track. So here's my challenge to you. Don't wait. Get your numbers checked. You can do that here at MedsPLUS. We offer full biometric screenings here in our office. My next challenge is to ask questions about your health. If you don't know what your blood pressure number means, ask your healthcare provider, including your pharmacist. If you don't know what it means that your A1C has been trending upwards, ask your healthcare provider, including your pharmacist. If you don't know why you're taking a particular medication or the best way to take that medication so that you get the best outcomes, ask your healthcare professional, including your pharmacist. It's important that you understand all of these things and that you choose a healthcare team that will advocate for you. If you need help getting started, we're here, because closing the gap in healthcare starts with action, and it starts with you. At MedsPLUS, we're here to walk that journey with you every step of the way. I want to wish you an amazing Minority Health Month. This April, again, I want to challenge you to know your numbers, ask questions, and find a healthcare team that works for you. Thank you very much for joining this week's MedsPLUS Medical Minute. We will see you next week. Have a fantastic week, everybody.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.